Understanding obstructive sleep apnea. A deep dive into a silent nighttime invader. Hey there, curious minds. Ever had one of those nights you wake up more tired than when you went to bed? Maybe you've been told you snore like a chainsaw? Well, today we're diving into obstructive sleep apnea, a condition that could be the culprit. Don't worry, we're breaking it down so you can understand it by the end of this video. What's the big deal about obstructive sleep apnea, OSA? Obstructive sleep apnea, OSA, is a common sleep disorder that affects many people. It happens when the airway in the throat gets blocked during sleep, causing a person to stop breathing for short periods. This can lead to various health problems and affect a person's daily life. What happens in obstructive sleep apnea, OSA? Imagine trying to breathe through a straw, but sometimes it gets squeezed, making it hard to get air. That's similar to what happens in OSA. When you sleep, the muscles in your throat relax, and the airway can get blocked, causing you to stop breathing for a few seconds. This can happen many times during the night, and you might not even realize it. If Mr. OSA keeps messing around, you'll wake up tired, even if you slept for a long time. It's like trying to watch your favorite cartoon, but someone keeps pausing it. You can never enjoy it fully. Imagine your throat is like a tunnel. The air is a car driving through it. Now, what if there's a traffic jam in the tunnel? The car can't move, right? That's what happens in the condition called obstructive sleep apnea, OSA. Your airway gets blocked, making it hard to breathe while you sleep. It's like a bedtime story gone wrong, and you wake up feeling like you didn't sleep at all. So, how do you know if you're stuck in this traffic jam? You might feel super sleepy during the day, snore like a freight train at night, and find it hard to focus. You might even wake up a lot to go to the bathroom or catch yourself gasping for air. It's like your body's alarm clock going off at the wrong time. Why should you care? But first, subscribe now to become an official member of our Sleep Savvy Squad. You'll get exclusive content and first dibs on all our upcoming events. Trust us, you don't want to miss out. Smash that like button. The more likes we get, the more people we can help understand the mysterious world of sleep disorders. Let's make knowledge go viral. Ring that notification bell so you never miss out on our weekly deep dives. We're talking life-changing advice, mind-blowing facts, and maybe even a bedtime story or two. Back to our question. Why should you care about obstructive sleep apnea, OSA? For starters, this blockage means you can't breathe for a bit. It can also make you really tired during the day because, let's face it, constantly waking up in a mini panic isn't restful. Signs that you might have OSA. 1. Feeling tired all the time and feeling tired during the day. You know that feeling when you've binge-watched an entire season overnight? It's kind of like that, but without the Netflix. 2. Loud snoring. If you sound like a tractor engine when you sleep, that might be a sign. 3. Suddenly waking up. Imagine your body's internal alarm clock going off randomly. 3. Annoying, right? 4. Difficulty focusing. Have you ever tried solving a Rubik's Cube while riding a roller coaster? That's how focusing feels when you're sleep deprived. 5. Waking up with a dry mouth or headache. 6. Trouble concentrating. 7. Gasping or choking during sleep. The domino effect. Not treating OSA can lead to other problems like high blood pressure, heart issues, and even diabetes. Think of it as knocking down the first domino in a long chain of health issues. Health risks of OSA. OSA can lead to serious health problems such as high blood pressure, heart disease, stroke, type 2 diabetes, weight gain. How does OSA lead to these severe health problems? When you have sleep apnea, you stop breathing for short times while you sleep. This happens because your airway gets blocked. Therefore, your body doesn't get enough oxygen while you sleep. This can cause significant problems. Here are some ways sleep apnea can hurt your health. High blood pressure. When you have sleep apnea, your body makes more stress hormones. These can make your blood pressure go up. High blood pressure is bad for your heart and blood vessels. It makes your heart work too hard. Heart disease. Sleep apnea causes your oxygen levels to drop at night. This strains your heart. Over time, this strain can make your heart weaker and lead to heart disease. Stroke. Sleep apnea increases something called inflammation in your body. Inflammation can damage and clog your blood vessels. This makes you more likely to have a stroke. Diabetes. Sleep apnea disrupts your sleep and can make your body less able to use insulin properly. Insulin controls your blood sugar. Poor insulin use can lead to diabetes. Weight gain. Sleep apnea makes you tired during the day. When you're tired, you tend to eat more calories. The extra calories can lead to weight gain over time. Excess weight makes sleep apnea worse. So, in summary, sleep apnea stresses your body in different ways that can lead to these health issues. Causes and risk factors of obstructive sleep apnea, OSA. Some common causes and risk factors for OSA include obesity. Obesity is a significant risk factor for OSA, with a high prevalence among obese patients. The American Diabetes Association also highlights obesity as a risk factor for OSA, particularly in individuals with type 2 diabetes. Weight gain can lead to increased fat deposits in the neck and abdomen, narrowing the airway and increasing the risk of OSA. Obesity is a significant risk factor, with 60–90% of patients with OSA presenting with a body mass index greater than 30 kilograms per square meter. Certain ethnic groups, such as Black, Hispanic, Latino, and Native American, Alaska Native persons, have a higher prevalence of OSA, partially explained by higher rates of obesity, asthma, and tobacco use among these groups. Age, more common in older adults, age is another risk factor, with OSA prevalence increasing. The U.S. Preventive Services Task Force, USPSTF, identifies older age, 40–70 years, as a risk factor for OSA. Male gender. The prevalence of OSA is also higher in males, older adults, 40–70 years, and postmenopausal women. Family history. Craniofacial and upper airway abnormalities, such as enlarged tonsils or a long upper airway, can also predispose individuals to OSA. Some examples of craniofacial and upper airway abnormalities include enlarged tonsils, a long upper airway, a short lower jaw compared to the upper jaw, and a large tongue that may block the airway. To better understand that, imagine your throat is like a tunnel. Air must go through it when you breathe. Sometimes, things like really big tonsils, those squishy things at the back of your throat, or a longer tunnel can make it hard for air to pass through. It's like when a tunnel is too narrow for cars to go through easily. This can make people more likely to have OSA when they have trouble breathing while sleeping. Think of it like a game of tunnel trouble. If there are too many obstacles in the tunnel, it's game over for smooth breathing. Smoking and alcohol use. Tobacco use is also associated with an increased risk of OSA. Smoking can cause inflammation and fluid retention in the upper airway, contributing to airway obstruction. Alcohol consumption is another lifestyle factor that can increase the risk of OSA. Alcohol can relax the muscles of the throat and interfere with the brain's control over the upper airway, leading to an increased risk of airway obstruction during sleep. The American Diabetes Association notes that the prevalence of OSA among individuals with type 2 diabetes may be as high as 23%. Finally, sedentary behavior and lack of physical activity can contribute to the development of OSA, often through their role in promoting obesity and associated health conditions. Diagnosis and treatment. How do you know you have obstructive sleep apnea, OSA? To diagnose OSA, doctors usually perform a sleep study called polysomnography. It's like a sleepover at a lab, where they monitor you while you sleep. They look for those moments when your airway gets blocked and how it affects your sleep. What can you do? Once diagnosed, there are several treatment options available, such as lose weight. Less weight often means less blockage. Other lifestyle changes like quitting smoking and avoiding alcohol can help reduce OSA symptoms. Sleep on your side. It keeps that airway open. CPAP machine. It's like a mini fan that keeps your airway open. Imagine sleeping in a wind tunnel, but way less extreme. Continuous positive airway pressure, CPAP, machine. A device that helps keep the airway open during sleep by providing a constant flow of air through a mask. Oral appliances. Custom-made devices that help keep the airway open by repositioning the jaw or tongue. Surgery. In some cases, surgery may be needed to remove excess tissue or correct structural issues in the airway. Now, test your knowledge. So, did you get all that? What does Mr. OSA do when you're sleeping? Why should you care? Keep watching for the quick recap. But did this deep dive into obstructive sleep apnea keep you on the edge of your seat, or better yet, keep you awake? If you're nodding, and not because you're sleepy, then we've got something special for you. Subscribe now to become an official member of our Sleep Savvy Squad. You'll get exclusive content, sleep tips that'll have you snoozing like a baby, and first dibs on all our upcoming events. Trust us, you don't want to miss out. Smash that like button if you learned something new today. The more likes we get, the more people we can help understand the mysterious world of sleep disorders. Let's make knowledge go viral. Ring that notification bell so you never miss out on our weekly deep dives. We're talking life-changing advice, mind-blowing facts, and maybe even a bedtime story or two. Share, share, share. Got a friend who snores louder than a rock concert? Or a family member who's always yawning? Click that share button and spread the word. Remember, sharing is caring, and also, it gives you major social currency. Understanding OSA can help you live a healthier, happier life. So, let's turn the page and start a new chapter where you're the hero, not the victim, of your sleep story. Quick recap. OSA is like having a boulder in your airway tunnel at night. It can make you tired, snore loudly, and even lead to other health issues. But don't worry, there are ways to tackle it. If you think you might have OSA, it's essential to talk to your doctor. They can help diagnose the condition and recommend the best treatment options for you. Treating sleep apnea is important to protect your health. I hope this explanation clarifies the complex world of obstructive sleep apnea. By breaking it down like this, you don't have to be a doctor to understand why getting quality sleep is so important. Now, go forth and share this story. Who knows? You might just help someone sleep a little easier tonight. Feel free to drop any questions you have. Written by Dr. Shama Solomon. At ClearMed, we love to share what we've learned and help others understand it easily, even if they are new to the topic. Disclaimer. Hey folks, while we strive to make this information about obstructive sleep apnea as accurate and relatable as possible, it's essential to remember that this isn't a substitute for professional medical advice. Stethoscope. If you're experiencing symptoms or have concerns, it's always best to consult with a qualified healthcare provider for a proper diagnosis and treatment plan tailored just for you. So, while our guide aims to be a helpful starting point, think of it as a friendly neighbor lending you a cup of sugar, not a bakery giving you a whole cake. Stay safe and take care. Thanks for watching.